Hi, I'm Dr. Philip McMillan. Thank you for joining me as I talk about something that has been a concern for me for a long time, and it's about the risk of myocarditis with regards to COVID vaccinations. Now, you have to remember that over the past few years, there's been a lot of reassurance that everything was fine, but I was raising the question about whether or not adequate research had been done. And so I'm not able to speak freely because some of the things I'd like to say is very important that if you want to hear them, you need to click on the link below where I'll be having a free webinar where I'll detail exactly why this is so significant. And what am I talking about? I'm talking about a very important study that was published just recently. And this is here is a Swiss study. And this is showing sex specific differences in myocardial injury incidence after the COVID 19 booster vaccination. And it was published on the 20th of July 2023. As I said, I can't go through it in significant detail here now because I don't know what is safe to be said. So you have to join me on my webinar where you'll be able to hear me break this down in far more detail. But I just wanted to highlight an important point from the discussion of that paper. And if you want to see the paper yourself, the link is as well in the description. And what the study demonstrated, and this is it highlighted here, their finding confirmed the study hypothesis that mRNA 1273 booster vaccination associated elevation of markers of myocardial injury occurred in 1 out of 35 persons. That's 2.8% of the group, a greater incidence than that estimated in the meta-analysis of hospitalized cases with myocarditis, which was estimated at 0.0035% after the second vaccination. Now, why is this study so important? It's because this study actively looked for myocarditis. And I'll give you the example of what has been done before and why I'm feeling so upset about this. I'll show you another paper that had been done, and this one is in circulation. This one was published this was in September 2022, looking at myocarditis after the third booster dose in Israel. This is what they were doing. So during the surveillance period, they looked at a big cohort, and of that, 91 cases of myocarditis was reported. That's the important thing, was reported. They were not actively looking for myocarditis. They were waiting for myocarditis to come to them, where it is so obvious that the patient has myocarditis. That's what you would then deal with. When you're looking for something, you really look for it. And this is again why I'm upset, is because actually in November 2021, for those who have been following this, I made a post, and this was the time when I was on LinkedIn, which is, should we actively look for post-vaccination myocarditis in the young? And this was because there was an Astroworld concert where they had 11 cardiac arrests on the scene, which was absolutely unusual. Even though this was a crush incident, you wouldn't expect people to have cardiac arrests, 11 of them at a concert. That was my first clue to the fact that we really needed to look actively for myocarditis. How do you look for myocarditis? Well, when it's convenient, people look for it. And this is what they did. When they wanted to find myocarditis, this is what you do. This is in May 2021. This time they were looking for myocarditis in patients who had recent SARS-CoV-2 infection. And this was the Big 10 COVID 19 cardiac registry study. And they looked at 1,600 athletes who were then screened. And when they screened them, they did a number of investigations, including echocardiogram, troponin tests, cardiovascular MRI imaging, looking for it. And they found in this study here that if it was just based on the symptoms around myocarditis, they would only find a very tiny fraction of the cases were actually symptomatic. And when they looked for it, they found almost a 7 times increase in cases. So, in this study that was done in Switzerland, they only looked at troponin, nothing else. That's it, really. They didn't do a cardiac MRI. And so, what you will realize is that that is far more sensitive. The point being, when you need to do research, when you are looking, when you are properly trying to identify risk, you look for it. You don't wait for it to come to you. That's what the Swiss at least started to do. Troponin is only one step. They still haven't matched the Big Ten study when they looked for it with COVID infection, where they did a cardiac MRI. This raises some very serious questions. And again, I can't cover them here. Make sure you click on the link below. This is the study from the Cleveland Clinic. And this highlights that in patients who were not up to date with their COVID vaccination, they had a lower risk of infection than those who were up to date with their COVID boosters. So here you have a situation where we know that myocarditis can occur from the infection. We're now clearly seeing that the vaccine boosting doses can also cause myocarditis. What happens when this is combined? This is a really, really serious question. Sadly, I can't deal with that question here. Click on the link below if you want to follow through on what I'm talking about. These are the times where we need answers, and we need to understand what those implications are long term for cardiac health. This is a time for us to really look hard at the evidence, reflect carefully on where things are going and what we're likely to see in the future. I hope you find this valuable, and please remember, click on the link below. Have a great evening.